Let's go through the different stages of the menopause transition. Hopefully this can help us understand maybe where someone's at. Welcome back to the New School OBGYN. My name is Eric Schmidt. It matters where you get your information. I'm a board-certified OBGYN. So let's answer the question, what stage of menopause may a particular person be in? So mostly in this talk, we're going to be concentrating on this table in front of us, the stages of reproductive aging, going over the menopause transition from early menopause, late menopause, and then early postmenopause and late menopause. Okay, and so there's different hallmarks of each of these stages of reproductive aging. And so in the early menopause transition, you're going to see that the length of the menstrual cycles starts to become more variable, okay? And this can be variable length. This is greater than 7 days difference in the length of consecutive cycles. And so, some people might have shorter cycles. Some people might have longer cycles. Quite often, someone may be like, oh, my cycle is only a few days long. Great, perfect. I might be transitioning. This might be great. And then for a couple cycles, bleeding for 10 days, 20 days, things like that. And again, often we are naming the stages of menopause with the principal criteria, which is the menstrual bleeding. I've talked a lot about it before. Not my favorite diagnostic criteria for menopause, but we are where we are. And so you're going to know some potential hormonal changes too. The FSH, which is one of the best ways to diagnose if someone's in menopause as far as lab values go. It becomes more variable. The cycle, as someone may be not consistently ovulating, the hormones of the cycle can be more volatile. And so you're starting to get some variability in this area too. And then maybe not as many of those hot flashes, night sweats quite yet at this time in the early menopause transition, mainly just the bleeding irregularities. With this menopausal transition, we are also starting the term quote unquote perimenopause. And so that is a very useful term. It helps us really kind of gauge the symptomatic nature of this transition. Okay, so jumping on over to the late menopause transition. This time period generally lasts about 1 to 3 years. Okay, and so generally this is when someone's coming in, seeing us, and like, okay, I haven't had bleeding for 60 days. And generally people are 45 years or older at this point, but they start to see gaps in their cycles, significant gaps. And that's really the big telltale sign that potentially someone is going through this late menopausal transition, as these big gaps between cycles. Now, while there can be big gaps and no bleeding, which I imagine could be very nice, there also can be heavier cycles that come when it does come. And so if you're at all disrupted by a lot of this, please seek the help of your doctor to figure out if there's something that can be done. Again, more hormonal changes with the FSH continuing to go higher, continuing to, because there's less follicles in the ovary to give off. The brain is really trying to pump out that FSH to get more follicles to release and have ovulation. They're just not there. And so, but this is a stage where you're going to get the higher chance of those symptoms, those disruptive symptoms. Mainly we talk about the hot flashes, night sweats, but also the cognitive mood changes too. And so, it can be a pretty disruptive time. And often getting people coming to us at this point in time, 45 or older, to talk about options for treatment, which we will get into. Stay tuned. And so eventually those periods stay away. And so the greater than 60 days turns into, 3-4 months, turns into hopefully a year without. And when that's our diagnostic criteria, for better or worse, if someone goes a year without bleeding, their diagnosis is menopause. And so you've made the transition to menopause, and should not have bleeding or uterine bleeding from that point on. And if you do, come get checked out. We'll talk about it and find out the best investigation and treatment for you. Moving right along, we're going into the early postmenopause. And so this length of time is around 2 years. And again, we're not going to talk about menstrual bleeding because really someone shouldn't have any bleeding after this point on. So the early postmenopause lasts a couple years, broken down into a few different subcategories, plus 1A plus B, 1B, plus, I can't say that for some reason. And so broken down to a few different stages, and you have the symptoms mostly in those first A and B. As far as the endocrine or hormonal criteria, you are still getting some variability in the hormones. Maybe the FSH is starting to peak at this point in time, but really the eggs have depleted, they're gone. And this is actually most likely to have symptoms in this stage versus even the previous stage. And so same symptoms that we talked about, hot flashes, night sweats, mood changes, the cognitive changes, the skin changes, hair changes. And so please come see us if you are experiencing these. We likely can help you out or at least give you options. In that late part of the postmenopause, again, no bleeding at this point in time. This lasts from 3 to 6 years after the final menstrual period, and things are kind of stabilizing at this point in time. Before we jump into the last one, which is the late postmenopause. And the late postmenopause, luckily, a lot of those symptoms of the changes of the hormones of the previous stages are kind of hopefully getting better. But there can be some increase in other changes too from now the lack of estrogen for the years that have come across. And so often that's when we get this urogenital atrophy changes, which can be pretty significant for some, with a very easy low risk fixes, and we'll get into that in the future. But spoiler, I mean, a little topical estrogen often can do wonders for these areas in this late postmenopause period. And so quick overview of the different stages of the menopause transition and postmenopause. If by chance you have any questions about this, you want to hear a specific thing about menopause and through our menopause talks, comment below, because if you're wondering, I'm guarantee you there's others that are wondering watching this. Okay, so we'll talk soon. Hopefully see you soon in the next video. I'm hoping next week. All right, guys, talk to you later.